Good evening. Today I'll be talking about managing retinal disease with cataract with no fundal glow. Doing cataract surgery is always exciting, but doing it where there is no fundal glow is not always amusing. In such conditions, retroillumination is quite handy. Of course, it is done where we also have to go for persplana as well. I would like to share my experience with chandelier retro-assisted phacoemulsification. So let's darken the room and enjoy the video. Here you can see I'm doing a retroillumination through a chandelier light. And just to show you the view, this is the rexis I'm starting. The nick I have done. I'm just taking the nick here with the cystatum. But I will just illuminate the microscopic light and show there is no such fundal glow here. But when I'm using the retroillumination through the chandelier light, you can see how nicely I can see the enterocapsule. Of course, I have stained it with this blue Rex and to make it more visible. But to be very honest, in a cataract with a retroillumination, you can also manage without a blue Rex in some cases. Now you can see here how nicely I can visualize. So my capsule Rex, I can make it round. I'll take my time and make it round here. You can see with the cystatum, and eventually I'm very comfortably completing my capsular rexis. And when this capsular rexis procedure is done, I will take it one step ahead and do the retroillumination procedure and some hydro dissection. This can be done with microscopic light, but I'm trying it with the retroillumination and I can nicely appreciate the hydro dissection. Now also you can see here, I'm rotating the nucleus and just starting my phaco procedure where the trenching is done here. And just, you can see here how nicely you can appreciate the depth, and using the left hand I can actually crack the nucleus layer by layer till the base. You can actually appreciate the posterior capsule here, and you can see I'm rotating it and just making sure that the two hubs are more or less separated. You can see here I can actually see the posterior capsule, so I'm very confident and not creating any problem here. And you can see layer by layer I'm separating it very nicely, and actually I'm just doing the same procedure like this, and I'm having fun doing all the pieces. So I'm just doing as many pieces I can and cracking it, as I said, layer by layer till the base. You can see this. And just to show you through the microscopic light how it feels, I'll just switch on the light of the microscope and just show you that how it looks. Just here you can see this one, and you can appreciate that through the microscopic light. This is like this. You can actually complete the procedure, but I'm preferring it to do it with retroillumination. That's all my video is all about. So I'm just completing it. The last piece I'm taking it, and eventually after that you can do a eye procedure with the microscopic light. It's not very difficult in a vitreous hemorrhage case or where there is no fundal glow, but even you can take it one step ahead and do the rest of the procedure through retroillumination, as you can see here. And you can actually appreciate the enterocapsule very nicely. This is the intraocular lens I'm putting through the retroillumination procedure. Of course, here I'm holding the light in the left hand, you can see, and I'm pushing the plunger and putting the intraocular lens inside, and I can appreciate the enterocapsule. Although you hear the video, it is not shown clearly, but you can actually put the lens, and at last it is completely done. So in my experience, capsular rexis part is the most useful and helpful step in this procedure. Nucleus separation up to the base can be appreciated very nicely. Rim of the enterocapsule can be nicely appreciated while doing irrigation aspiration and putting the IOL in bag. But we have to be extra careful during our maneuver, as the light probe can hit and rent the posterior capsule. Thank you all for your patience here.